I'm here with Dr. Drehsen, board-certified plastic surgeon at the Clinique of Plastic Surgery, who's very well known for his very unique refresher lift. And I am having a facial rejuvenation consultation that includes computer imaging, and I'm really excited to see what my potential results can be. But before we do, I'm curious to find out how realistic these results actually are.
Well, I have done at a minimum several thousand cases of computer imaging, and therefore I have to compare that obviously with the result I've obtained from the surgery. In general, I'm very close, and sometimes the result have been better than what I forecasted with the computer imaging. Computer imaging is good for both. The patient first, they can see why we decide to do such and such procedure. They see also the overall change of their face. It might require, improving the expression or reestablishing a high cheekbone, or maybe sometime only correcting the neck. So all this can be pretty much demonstrated by computer imaging, as long as you respect the limitation of each one anatomy, I'll say.
Oh, fantastic.
So basically, I've never had any problem with the computer imaging, and I think it teaches the surgeon as well the benefit of one procedure versus the other one. For instance, sometimes you do a chin implant along with the thing, sometimes you do a correction of a nose that is undesirable. So it illustrates what can be done as an overall rejuvenation process for the patient and for the surgeon.
Oh, that's fantastic. Well, I'm excited to see what you can do for me. Dr. Drehsen, wow, what a difference. What a change in my jawline and my neck and my cheekbone. And actually, I am surprised even seeing it. So it's very exciting to see what you can do. And so how would you get these actual results?
Well, actually, it's any kind of full face rejuvenation in the modern days is basically correcting what we call the aging vector. You can see here that everything is going down and so on. So to get a natural result, you need to kind of go back the other way around. It's called like the vertical facelift, vertical rejuvenation, you name it you want to. So how is it achieved? It's achieved through internal work. The internal work is basically imagining internally that the fat in your cheek has kind of unraveled, and you bring it back up and you move it backwards. So to give a high cheekbone, a glamorous high cheekbone. So I see more and more younger women in their early 50s, for instance, coming back to get their face done because they love the beauty of their face. Basically.
Oh, that's great. So you're using their actual deep tissue in order to keep them from not having to have all the injections or the fillers.
Absolutely. Injection after a while creates some serious problem. The fat injection itself is very unpredictable and sometimes make you look like a clown. So the idea is to bring back what you had and put it back where it used to be. Okay?
Oh, that's great.
Along the jawline, we have sometimes for most people, the neck get blunted by the sliding muscle. Around the skin, they slide and they start blunting your neckline. So basically the repair in great part is basically suture this muscle together to recover the depth of the neck. In addition, some people have fat, we remove the fat and so on. As far as the chin is concerned,
look how much younger I look. That's
yeah, for sure. Wow. No, not everybody is gifted to have, so different neck have different capacity of yeah.
That's great. Now, how about because I am a little concerned, is the incision and if it would actually affect my hairline. So I would like to learn a little more about how you would perform that incision.
Yeah. Basically, I have no fear of making the incision along the hairline, and zigzagging in a bevel fashion into the hairline. You say, why? Why don't you put it backward? The last thing you want to see is your hairline moving backward, like you can see some women, especially when you have a fairly high hairline.
Exactly, you can shorten mine a little.
So basically the idea is to almost bring the hairline down some.
Yes.
This incision, a bevel incision, allows the hair to grow through the skin edge, so the hair passes through it, so you don't see the scar.
And the hair grows back nicely. Oh, that's great.
Go back nicely into it. So
Do you have an actual image of your post-surgical hairline?
yeah, we have
Okay,
can be shown after this demonstration here. So basically here, obviously we have to make an incision in the skin beyond the hairline. So it follow like the crease of the ear, goes inside the ear like this and go back around this, and that's about all you can ever see. This healed perfectly fine.
Nice.
Now, in addition to zigzagging the incision, we also treat at time of suture removal, we treat it with some laser treatment so that it becomes virtually invisible.
Fabulous. Wow, that's a post-surgical result. I don't even see the incision line at all.
Well, indeed, I mean, if you, as I just mentioned, make your incision in a bevel so that the hair can grow through the skin and through the scar,
That's
this
fabulous.
becomes essentially invisible.
Oh my gosh, that's great.
This is a picture after 3 months of the temple incision, and you can see that it's virtually invisible as well.
Wow, that's phenomenal. That's only 3 months. Thank you, Dr. Drehsen. This is fabulous. So if you're interested in viewing your potential post-surgical results, call Dr. Drehsen at the Clinique of Plastic Surgery at 727-592-0991.